Welcome to the National Patient and Family Engagement Learning and Action Network Kidney Caregiver Peer Connection Call. We appreciate your interest in this topic. Today's call is meant to be an informal way for caregivers to ask questions of other caregivers who have experience with the kidney disease journey. Before we get started, there are a few items we'd like you to remember. All lines are currently muted. The lines will be unmuted after we introduce our panel of caregivers. Please be respectful when asking questions and do not speak over someone else. We also ask you to take the call in a quiet location and mute your line when you are not speaking. This call is being recorded and will be made public on the NCC website. We will also promote it on social media. Please do not disclose any personal identifiable information. Do not share any information that you would not want to make public, such as your date of birth or the name of your dialysis facility. Please do not ask for medical advice. The role of the panelists is to share their personal experiences dialyzing at home. If medical advice is given or asked, the NCC will interject in the conversation. Each person's situation and experience is unique. The treatment plan for each patient is unique to their personal needs and various factors, including other medical conditions. Before making changes to your health practices, speak with a member of your healthcare team. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. The views and opinions expressed during this call are those of the panelists and do not necessarily reflect the official policy or position of the ESRD NCC or the Centers for Medicare and Medicaid Services. Any content provided by the panelists is of their own opinions and is not intended to substitute for professional medical advice, diagnoses, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you have regarding medical conditions.
For those of you joining us by WebEx, you now see a photo of the NPFE-LAN Team. I am Kim Bittner, and you previously heard from Jerome Bailey. We work with a group of patients with end-stage renal disease and their caregivers to design and spread practical approaches that can be used to help other patients become engaged in their health and care to improve their quality of life. We've selected a group of 3 subject matter experts from the LAN group to answer your questions and share their individual experiences. We'd like to thank them for agreeing to join us today. We have Candise Washington from Michigan, who has been a caregiver for her father, who was a home hemodialysis patient. We have Barbara Hoffpauir from Louisiana, who's a care partner to her husband, and Yalonda Moore from Alaska, who's a care partner to her husband. To learn a little about each of you, we'd like to ask you a question. We're going to ask them each the same question. What 3 words describe your experience as a caregiver? So let's start with Candise. Can you give us 3 words that describe your experience as a caregiver?
Yes, I can. The 3 words that come to me is caring, humble, and brave as being a caregiver.
Thank you, Candise. Thank you very much, Candise. And Barbara, what 3 words describe your experience as a caregiver?
Yes, ma'am. Prayer, readjustment, and gratitude.
Thank you very much. Great words. And Yalonda, what are your 3 words to describe your experience? We are...
Kim, we're getting some feedback from Yolonda's line. There you go, Yalonda. Your line is open now. All right. Kim, can we see if we can get back to Yalonda later on in the call?
Okay, we will go ahead and try that, absolutely. So I want to thank you both for providing those 3 words. And as you can see, everyone has different experiences, just like what Jerome had stated. And before we take questions from our callers, we asked for and received a few questions before this call. So we'd like to start off with some of those questions. And as we're going through these questions, if any of you are on the WebEx, feel free to use the chat box to submit any questions that you might want to pose to our panelists, and we can include those questions as well. But let's go ahead and start with one of the questions that we received. Has your role as a caregiver changed in this era of COVID-19? Candice or Barbara, do you want to answer that one?
Well, go ahead, Candise.
No, you can go ahead, because all I was going to say is I really can't speak on that one because my father passed. So y'all can take that one.
Okay. My role has changed because of just the fact of having to stay home. My husband goes to dialysis at a clinic 3 times a week, and that means he does have to get out. I have. Can you hear me? Okay. Are you okay now?
Yeah, we can hear you.
Okay. And so whenever he has to go, I usually drive him. But I've had some things happen with arthritis, so now he's driving himself. I can't go into stores because they want us to stay in because of our age. So, and then he's had to go into the hospital for emergency room, but he's been allowed to come home. They've been able to treat him and send him home. So it's just little things like that. It's kind of an inconvenience, but I must say that everybody has been very helpful in the hospital as well as at the clinic. And we've had neighbors that have helped in a lot of different ways. So that's the ways it's changed mainly.
That's great. Thank you for that, Barbara. Definitely good feedback, and I'm sure a lot of people can relate to some of those changes as we've all kind of had to adjust. Here's one that we also received. I'm thinking about trying a support group, but I'm not sure of the benefits. Have you used a support group for caregivers, and was it beneficial for you?
Can I say something on that? This is Barbara.
Sure.
I have not used a support group, but at the very beginning when we first started dialysis, we had to wait in the waiting room for a period of time, and that was very beneficial to us because we got to visit with each other and hear about others' experiences. Some of them were caregivers, some of them were patients, but we found that to be helpful, encouraging, even though you might hear scary things, it also had encouragement to it, to some of the things I had to say. I felt like it was beneficial, and so did my husband. Thank you.
No, thank you. Candice, did you?
No, we didn't. I didn't get into the care group, a support group. But if I could, I would have done it. Because it was very hard. I had the support of my family, so we all learned how to hook my dad up and put him on the machine. So that was like my support team. When I couldn't do it, I know my brothers had my back and my mom had my back. But if they had a support, like caregiver support team, I would actually go to it and actually do it. But we didn't have that where we was at. So.
Thank you for sharing that, Candice.
No problem.
Did I hear you?
Yeah, I have a question that came in through the chat feature. When you have a concern about being a caregiver, do you talk to anyone on your loved one's care team? And I know that would be past tense for you, Candise. Did you talk to someone on your dad's care team when you had a concern about being a caregiver?
Yeah, so when I first started to be his caregiver, I didn't know anything. It was a whole new change. So I was communicating with the nurse all the time because it's a learning step. Every time you put a person, or when I put my dad on, it was something new or something that might have happened, or even if it did happen, I still reached out to the nurse about, okay, this happened. What do we need to do? Are we okay? Do I need to take him to the hospital? So I was in constant communication with our nurse, and sometimes I even had to talk to his doctor that was on his team about what happened, what's going on. So it's good to have that open communication and not be afraid to say, oh, I don't know what's going on or I need help. And my father team was very, very supportive, and they made sure everything was good, everything was right. If I needed a break, they even said, come on in, I'll dialyze it for him, and you take a break because we know you're in school and everything. So I love my team. So we still, to this day, I still can talk to them and get letters of recommendation and things like that. So I'm happy and was blessed to have a team that supported us that good.
Yalonda is now with us. What about you, Yalonda? When you have a concern about being a caregiver, do you talk to anyone in your loved one's care team? I'm sorry. We're still getting some background noise from Yolonda's call. Barbara, do you mind responding to that question?
Okay. Yes, I can. You asked whether if I had a question as a caregiver, who would I go to? Yes. Okay. As a caregiver, I might first go to the clinic. I have found them very helpful. And then I might, if I hadn't done it already, I would also perhaps go to the doctor. He would sometimes give us a direction to go in. And if I needed to talk to somebody just related to my feelings, which I might, if it were brand new to me and I just was frustrated, I would go to one of my family. Actually, I would say, I need for you guys to pray for such and such. I've done that a lot, just to calm down my fears and give me confidence to take the next step, whatever it might be, because sometimes it was kind of scary to think, what should I do next? This is a big responsibility. And so that's probably the order I would go in. But the team at the clinic have been they've been very helpful. The nurses and the techs, and even the social worker has also. Okay, that's probably what I do.
You know, with COVID-19, we've heard about many caregivers feeling isolated. And if so, what do you think a facility staff can do to help with those feelings? To help caregivers feel less isolated, like they're in it by themselves.
There's been times that those people who are actually doing a lot of the hands-on that particular day or during that week will make comments to my husband. And a lot of times it's helpful. We've also had information sent home, which has been helpful on different aspects that's going on at the clinic, and those have been helpful. And I would probably, at the clinic, a lot of times I'd go to the nurse first. I think it kind of depends on what situation is happening, but I would call the nurse because she would seem to know in most of the situations and what's happening and give a good direction to go in. And occasionally, if there has been the social worker, I'd call. But the tech has been helpful, too. I can't rule out anybody. She'll make comments to my husband while she's connecting him or disconnecting him. Anyway, I found them to be beneficial.
Candise, was there ever a time like you felt that you were in it by yourself and needed someone to talk to?
Yeah, I had those days. And what we did on those days, like things like that, when I feel like it just became too much, I talked to my brothers about it, talked to my mom about it, and I even talked to my dad. Because we are in a partnership. You need me and I need you, so we both can move forward in life. So how our relationship is, we talk to each other. We made sure we is comfortable. We made sure if one of us is not feeling good or something feeling bad or we got a bad feeling about something, we talk that out, like maybe we shouldn't do it or maybe we should do it. So we kept open communication all through his dialysis, all through every step, because it's bad to not have communication, because that's when it break down and being upset and stuff like that happen. So we made sure if one of us wasn't feeling too good or we just feeling bad or sad, we'll do a thing like, let's go get some ice cream. So or let's just go ride around town and just smile or have fun. Or some days it'd be 2:00 in the morning, like, you want to go to Don's Bakery and get a donut? Because they used to be open 24 hours. So because of everything that's going on, they had to cut their hours. But we'd do a 2:00 morning run and go get some donuts and laugh and have fun. So, and with my support team at the dialysis center, they knew I was in school and was taking care of him, and they knew I wanted to do like I was going to see my best friend for maybe a week. So he didn't trust my brothers to hook him up. And it's so funny. As much as they could, and they had all the lessons, went through training, he just wanted me to do it. So when I would go out for maybe a week or so, I'd tell him, well, you might as well go in center. And they'd be like, yeah, you can bring him in. We love Mr. Washington. He's just a fun man to be around. He makes us laugh all the time. So I love my support team. They were great. They was wonderful. And we rode it to the last day. So they even still check on me now. So that's why I really love our team that we had.
Oh, that's really sweet. That's really sweet. All right. I think we have like one more question in the queue, and then we'll open up the call to our audience that are on the call. But let's get this one last question answered. And the question is, what do you do to maintain balance between your life and your kidney caregiver life? So what do you do to maintain balance between your life and your kidney caregiver life? Did you have any hobbies?
I can take this. So what we did was we planned like fun days. So it could be like every 2 weeks we go out to eat, or you want to go see a movie that's coming out. So we made fun days, or you want to go on a little mini vacation to Chicago and back. So we made sure we was able to have fun and still you get on the machine or pack the machine with us because we going on a trip. And how I balanced it, I had a schedule. and I made sure I was on top of things where it gave me time to do my schoolwork, made sure to have time to put him on the machine and talk to him and engage with being with my loved one. And then I had time for my friends and everybody else. So I just balanced as much as I could. Some days it got stressful, and some days it'll be like, oop, easy day. So that's how I balance my life between being a caregiver and being just a regular person.
What about you, Barbara?
Well, I tell you what, our family is, we don't have any immediate family here in town, so we often will, I think it's called FaceTime on the phone, because we get to see them and talk to them at the same time, and we always look forward to those. Other things that we would do would be, we're not able to travel at this time. We watch movies. My husband actually he takes a walk down the street. I can't read too well because of my vision, but I have been using audiobooks, it's almost like escaping into your own world or another world. And we have church friends that we communicate with. We do a lot of talking on the phone, and other friends here in our area. And that's mainly the ways we move out of the, just going to the clinic. And I think probably our favorite is getting to talk with our family through FaceTime. We talk to them on the phone, but it's really special when we can see them and talk to them. And that's another thing about this virus. It has stopped. People can't, they can't travel state to state. Some of my family's way in the east, and part of them are in just the neighboring state. So they're not in the state. So that virus has really, it's kind of interfered.
No.
But
no. That's great. That's great. That seeing your loved one's face, even if they're only minutes away, using FaceTime or whatever mobile tool you have, you can still create special memories. So thank you both for sharing. We are now going to open up all the lines so that we can hear from some of the participants on the call. If you all have questions for our panelists, again, we're going to ask you to take the call from a quiet room. If you're not speaking, we just ask that you mute your line so that we can avoid as much background noise as possible. Okay, I will now open all the lines.
And Jerome, before we
go ahead.
I'm fine with that anyway.
I know Yalonda was going to try to call back in, so just going to
I did call back
ask
in.
if there she is.
I'm here.
Welcome back to the call.
Hi, Yalonda.
All right.
Glad to have you with us.
Hi, how are you? Sorry about that.
Yeah. No worries.
No, we're just glad we're able to connect with you now.
That's good. So do any of our callers have a question for the panelists?
Well, Lisa Baxter, I have one. I know how hard it was for me being a caregiver 3 times. How you doing? What was the hardest thing about being a caregiver would be my question to them.
Well, this is Yalonda. The hardest, can you hear me?
Yes, we can hear you.
Okay, just wanted to make sure. I think the hardest thing about me being a caregiver was, our original questions, one of my words was patience. And it was having to deal with having patience with my husband, because going to the doctor and not overstepping him. and letting him putting it to the point where he forgets who he is. So in other words, not smothering him, because as a caregiver, you have the tendency to take, and you go to the doctor, you want to answer all the questions, or you have the tendency to even though you're not thinking of them as sick or something, your mind kind of does, and so you have the tendency to overstep them a little too much, and so it's stepping back and having patience and letting them do things for themselves. So that was the hardest thing that I had to deal with, was just stepping back and letting him be himself and taking care of himself at times too.
Timmy's thoughts right here. Timmy's thoughts?
This is Candise. I think the hardest thing about being a caregiver is if they get sick. That was my biggest battle, because when my father got sick, you never know what it is. So you don't know where the infection might have came from. You don't know who you might have been around. You don't know any of those things or factors. So when he'll get sick and be in the hospital, I sometimes will blame myself. So I'm like, what did I do wrong? Even though it didn't have nothing to do with me, it was just maybe he just caught a bug that got worse, or he had a blood infection one time, actually 2 times. And I thought, oh, maybe I had poked him wrong, maybe I did this, maybe. It was none of that. So my biggest thing is, if the patient gets sick, is it my fault? What did I do wrong? How was it my fault? What can I do to make it better? So I had that battle going on a lot. And majority of the time, after he get better and all of that, and we find out what happened, it usually don't have anything to do with me. It was just the fear of, I don't want nothing to happen to him, and I don't want to be the reason why this happened to him. Or maybe I should have did more, maybe I should have did less. So that was my biggest battle when it came to being a caregiver.
This is Barbara. I think probably the hardest thing I found was not really going to the doctor, but at home when I had a tendency, going from doing lots of hands-on care to not doing any, and just giving time, allowing him to do for himself, because I would want to go ahead and do it. And I don't know if it's because I was rushing. I wondered, okay, am I rushing and being too, trying to get things done too fast? So I had to really, and I still do, have to think. And yet, on the other hand, you kind of get to thinking, well, am I being mean by not helping with these things, little things, just doing for himself? And so that has been difficult, to step back and allow him to have a chance to do for himself. That has not been easy. That's it.
Yes. Do we have any other questions for our panelists?
I have one more.
Okay, Lisa?
While I was on dialysis, I had to be a caregiver, and I would like to know if any of them had to do with being a caregiver and being seriously ill yourself.
This is Barbara. I have not been on dialysis, but I have had lots of problems with arthritis, which makes me be dependent more so on him at that time. And that is also difficult to know who to turn to. Like I said, these other folks, like our friends and our neighbors, family, that I have a cousin who in town. These kind of people have been helpful to us there. But I have come to, I've gotten to see another side of my husband, and we have come closer. It puts us on a different kind of level when you're both depending on each other for different things. That okay. That's
Thank
it.
you.
This is Yalonda. For me, my husband being we're at home PD. And for me, I had a total knee replacement, and trying to help him when he was sick, and then having to go to the doctor, and on top of him doing the PD, he had a stroke, so he had a short-term memory. So him going to the doctor and then having to be able to be at home, and him calling with the doctors to ask me different questions because he couldn't give the answers. So that made it hard because I was trying to do what he needed me to do from home because I couldn't go with him, but at the same time taking care of myself at home.
Wow, thank you. My husband had colon cancer. Wow, appreciate that. Thank you.
I would say what we mostly had to deal with is my school when it came to my father getting sick and stuff. So how we worked it is sometimes I would have to go take my test a little later on in a week or later on in the next few weeks. So that's how we kind of worked that. I had to I scheduled times and made sure, all right, today I'm not putting you on because I got to do work. Tomorrow you got to get on. So we managed like that. It was a give and take. Sometimes he likes to take more, and then sometimes I like to give more. So we both Aries. So I'm basically his little clone. So we know when we had our days, and we had our good days, we had our bad days, and we always, even with the bad days, we still made some fun out of it. So that was mostly what I was dealing with.
Yeah. Yeah.
Do we have any additional questions for the panelists?
Mm-hmm.
All right. We do have a question that was submitted in the chat feature. Is anyone's partner using telemedicine? And if so, what is your role with the telemedicine visit as the caregiver?
This is Yalonda. Gary, my husband is using telemedicine. And for us, for the most part, when he does his appointments, the doctor, they make sure that we're involved, make sure that myself and my daughter are involved so that they can find out so that they can ask us if there's anything, especially with this virus going on, what else they can do to help us get through it. And they make sure that we're involved so that they can give us suggestions as to things that they don't want, better things to keep him away from, such as, we did they've asked for it. His doctor asked us to come on so they can explain, well, it's better for you guys to go to the store. Well, when you get home, make sure to instantly change your clothes and wash up. So the telemedicine with us, it helps us be able to get in touch with his doctor and ask him what's the easiest way for us to handle the different things that are going on without him going in. So, and then what's the easiest way for us to be able to keep him safe.
Okay. Thank you. Barbara, any telemedicine in?
We have not
with
really.
you?
We have. My husband has had appointments over the phone, with the doctor, but he had previously had an echocardiogram done, and the doctor was telling him the results of that and reviewing his medicines and just doing a checkup over the phone. So mainly my role was anytime we go to the doctor, have any contact with them. We both try to go and be there so that we can verify what we hear and make sure we got the information right. And that was, we really didn't have any other issues with telephone, with telemedicine. And it was a good visit over the phone. It was better than going into the office.
Any other questions from the audience? I see that we have one last question in the queue, and it is, I guess this is for each of you, and we can start with Candise. What advice would you give a new caregiver just starting their kidney disease journey?
The new advice I would give, ask questions. It is never wrong to ask a question. If you don't understand it, if it's not making sense to you, or you want to know more information, ask questions. The doctors and the nurses are there to help you understand, to make this an easy journey for you and an easy journey for your family member. That's what I did. I asked many questions. I stayed asking questions. If something didn't look right medicine-wise, or they changed this medicine, I asked, why is we doing this? What would happen if this happened on the machine? What is this? Or what is that? Asking questions, I don't feel is anything wrong with asking questions. That's what I would say. Ask many questions you got.
Thank you, Candise. Barbara.
I agree with Candise. Ask all your questions, and if you leave and you have some more that pop up because, you've thought about something or something else has come in, I would either call them back or as soon as you can, write that question down and ask them when you go. And as far as medicines, I definitely agree. Find out why it's changed or why it's added, what it's for. When you pick it up, ask the druggist. Also read the literature. And I would also read up as, they give you a lot of paperwork when you first go into a clinic. Well, now I'm not familiar with how it is when you first start in the home, but we received a lot of paperwork. It was beneficial to read that, to look through that, and reference it as you can. All of that's very important. And talk, like she said, talk to the facility, also the doctors when they come by. Get as much information as you can. And, of course, your patient, the one that you're caring for, they should too. And keep an open communication between you and the one that, you're the one that you're caring for. That is very important because they're going to see things, especially as they go along through the process. They're going to see differently. You may both be seeing the same thing, but what they perceive is different than what you perceive. So it's extremely important to keep those communications good between you and your the one that you're caring for. Okay, that's it. Thank you.
Thank you, Barbara. And Yalonda?
One of the things that as far as being a care partner that I look at when it comes to that is when they go to the doctor, understand that you were there to help support them. So when you see something not right, because sometimes they don't always catch it, question it. Always, like they've been saying, ask questions because we've always said, like during our network, the patient, you're your first doctor, because you have to know the treatments. Well, as a care partner, you need to know what they're going through so that also if you see something not going correctly, to question it. So as someone going into it and starting off, learn the process, learn everything that they're going through so that you're able to help them watch and keep an eye on everything that they're going through, because you are also that first offense with them. So it's them as the first, you're as the second. So you need to know and understand and learn everything that the patient is going through, because you need to watch, because not everyone is perfect. So you need to be able to question anything that they don't see that you don't feel is correct.
Well, Yalonda, thank you very much. Kim?
I just want to thank everyone for all their great feedback and their participation and how they shared their caregiving expertise with us and everyone on the call. So now that we've been able to go through the questions, we want to go ahead and share a few caregiving resources with you. And for those of you on WebEx with us, for more information on caregiving options, you can visit any of the websites that are listed on the screen. A few of those resources include the ESRD NCC, the National Coordinating Center, and you can visit us at www.esrd.ncc.org/NPFE-LAN. We have several caregiving resources on there, one of which was created by patients for caregivers. You can also visit the American Association of Retired Persons, AARP, Family Caregiving. That's at aarp.org/caregiving. And there's a Caregiving Action Network, ESRD Rockstars, Family Caregiving Alliance, and National PACE Association. All of these will be available on the NPFE-LAN website when we post this recording later. Also, you can contact the ESRD NCC. We have our contact information up there. You can email us at nccinfo@hsag.com. You can call us at 844-472-4250. And then we also have our address up there as well. And then we invite you to follow us on social media. You can find us on Facebook by liking ESRD National Coordinating Center, or following us on Twitter at ESRD NCC. And then we also have a YouTube channel, so please visit us on YouTube at ESRD NCC. And again, we'd like to thank everyone for joining us today. Please keep an eye out for the recording of this, and we'll post the slides as well so that you can see this information. And thank you again to our panelists. And everyone, please have a good day and stay safe. Take care.
Thank you.